Well, now we're coming to one, it's already famous or notorious, how you can say, inconvenient study, and there is a documentary about it. I had here as a guest Mr. Del Bigtree, who organized to start this study in 2017, I think. And after finally they finished this study, they didn't want to publish it. Can you tell us exactly some details about this? We've been through this, but I think it's important because this is the first study that's showing difference between children who are vaccinated and who are not vaccinated and overall health.
Oh, I should tell you, there are about 10 other studies are out there that have compared kids with no vaccines with kids with one or more vaccines, and they are consistent. They all show that the kids who are vaccinated have multiple rate of the chronic health issues. And those studies most of them are published. Some of them are in PubMed, in the peer-reviewed literature. Now, they have, like I said, there are different kinds. Some are based on homeschool parental surveys. Some are based on government Medicaid data. Some are based on certain pediatric practices that happen to have a lot of unvaccinated kids in it. So they compared the vaccinated with the unvaccinated. I mean, they all are pretty consistent. And, this type of comparison, it's not like Dell decided, it's not just Dell who wanted this to be done, right? Or ICANN. The Institute of Medicine, which is a private organization here in the U.S., was paid by our federal health authorities to review the safety of the entire childhood schedule. They published that review in 2013, and they said, sorry, federal health authorities, you haven't really done a comparison between vax and unvax. How do we really answer this question? That's an important data to have. And so they said, but you can do it using some CDC data called the VSD. The CDC then commissioned a white paper. They paid hundreds of thousands of dollars on how to do this comparison that they published in 2015. Okay? And so that's 10 years ago. Have they published that comparison? No. They've never published that comparison. Have they done the comparison? Seems to me unlikely they haven't. If you wanted to, quote unquote, shut up the anti-vaxxers and those same vaccines cause harm, why wouldn't you just do that comparison and publish it? I think you probably would. And I think the problem is that when you do that comparison, I suspect what you find is that no matter how you try to play with the numbers, you keep finding the same result that all these other studies are finding, that the vaccinated kids have multiple times the rate of chronic health issues as the unvaccinated.
Yeah, I noticed one more thing. First, when they are doing clinical trials, they are not comparing a random placebo group. But also they said it's unethical if you want to do it, because first, before they are even starting clinical trials, they are they're introducing these vaccines. And after that, they said it's not ethical not to vaccinate the children. That's why we cannot make any more this random placebo group clinical trials.
Okay, two things. First of all, the bioethical literature is very clear that it is unethical to use a product that has not been properly trialed before licensure. That is unethical. Using a Hep B vaccine that was licensed, it's on a trial with 147 kids and 5 days of safety monitoring, that's unethical. And what was the control? There was no other vaccine as the control. There was no control. Okay. And we can go down the list. We can go through every vaccine. And what you'll find is let me put it this way. If there was a Hep B vaccine that already existed and it was properly licensed on a placebo-controlled trial, that vaccine should have been the control. I agree. But it didn't. It didn't exist. And that Hep B vaccine, for example, that was the very first recombinant DNA technology vaccine in the history of the world. In America. It didn't exist before. Think about that. Just like we have a new mRNA vaccine with a new technology, that was the first recombinant DNA technology vaccine in America ever. So it should have been, not only should it have been a robust trial, it should have been an incredibly robust trial. You don't even have a historical comparator of any kind. It's not even like they use another Hep B vaccine to license it for children. So that's first of all. This notion of, so I agree, it would be unethical if there was a properly licensed hepatitis B vaccine for children that was properly licensed in a placebo-controlled, long-term safety, properly powered trial. Absolutely, that should be the control, okay? Not a placebo. You don't have that. You don't have that for any vaccine. Okay. So it's unethical not to use a placebo. Number two, I'm not talking about a clinical trial prospectively. I'm talking about using existing databases of information. Health insurance companies have the data. Probably, we estimate about 650,000 completely unvaccinated kids in America today. Their data sits in databases today. I'm not talking about continuing to keep, I'm saying use the existing data. There is nothing unethical about that. And there's nobody who argues, by the way, that's unethical, because it would be nonsensical to do so.
Well, you also mentioned, and also I saw that you cross-examined Dr. Kathleen Edwards. Why is she important, and what did you find out in this conversation?
Well, Dr. Edwards is one of the four authors of the medical editors of the medical textbook on vaccines in the United States, which is called Plotkin's Vaccines. It's Dr. Plotkin, obviously, Dr. Edwards, Dr. Paul Offit, and Dr. Walter Orenstein. They are, considered presumably the four world's leading vaccinologists. And in this deposition, I went through a lot of stuff that I went through with Dr. Plotkin. All those years later after Plotkin, you'd think she'd have better answers. She doesn't, because the facts are the facts. They can't create clinical trial data that doesn't exist. They can't go back in time and properly create trials, license these products. And after they're licensed, because of the ethical point that you pointed out, they won't do proper clinical trials. So they don't do it before they're licensed, and then they don't do it afterwards because they say it's unethical. It's truly a religion of incredible proportion. And so, if you watch her deposition after you watch Dr. Plotkin, you realize that she has nothing more to give, let's put it that way. And she also, because it involved autism, specifically the issue of autism was at issue in this case, she should have come to that deposition prepared to fight me on autism, to give me the proof and the evidence. But yet when I asked her about, okay, what studies, do there studies that show that this Hep B vaccine doesn't cause autism, or this DTaP vaccine, or this, she also had to admit, I don't have any studies that show those don't cause autism.